Good afternoon. Welcome to Fridays with Friends. I am Carolyn Ware with Coast to Coast Legal Aid. Today I am here with Dr. Lenore Walker, Professor Emeritus at Nova Southeastern University. She researches various forms of gender violence, especially battered women, sexual assault, sexual harassment, sex and human trafficking, false confessions of women, and child abuse. She is a clinical forensic psychologist who testifies in cases across the United States. Thank you all for joining me today. Thank you, Dr. Walker.
It's a pleasure to be here.
Dr. Walker, can you tell everyone a little bit about your work related to battered women syndrome?
Well, I started my research back in the 1970s. It's a long time, almost 50 years worth of research. At that time, we were just beginning to talk about battered child syndromes. And so I started looking at the children and their mothers and realized that from my evaluations that these mothers were also being abused. So I just called it battered woman syndrome. Then I wrote a grant for the federal government and received a lot of money to be able to study, was there such a thing as a psychological syndrome or a collection of symptoms that measured whether somebody had been abused or not, or had the psychological effects of having been abused. And we spent 3 years studying it. I wrote some books. I testified before Congress, got some more money and grants, and began testifying across the country in these cases where a battered woman would kill her abusive partner in self-defense. She was trying to stay alive. She believed he was going to kill him. And we began to change the whole way the legal system looked at self-defense for a woman, that it would be a reasonable perception of imminent danger about whether or not she was abused. And so that became, I testified across the country in different cases because I, as a psychologist with all the right credentials to be allowed to testify in court, I was doing what they call first impression cases. These are cases that hadn't been litigated in that particular state. And we managed to get it into a lot of the states. And as we began, some of the states, we actually had to have the legislature change the laws. But in most of the states, it came in through these kinds of cases. And so that's how I began my career. After a while, when it wasn't necessary for just me to do it, that other psychologists or mental health professionals could do it across the country, across the world, really. And so I decided I wanted to train other people. So I went back to the university where I had started originally. Then I had been in practice for a while, and then I'm back to the university, and I went to Nova Southeastern University and developed their forensic psychology department there. And I was there for 20 years, and we continued our research into battered woman syndrome. We now have a screening device or a test that we are standardizing and working on it right now. I've published lots of books on the topic. I continue to testify in some cases, but really I have a whole staff of wonderful people who are psychologists who work with us in cases across the country.
Yeah. What is important for the community and caseworkers and even lawyers to know and understand about working with individuals who experience battered women syndrome?
I think the most important thing is to understand that it's a trauma, it's a traumatic event or events to be abused, and that they don't just go away once the abuse stops, that it stays in people's mind, in their memory, and it affects them psychologically. And so one of the areas is anxiety. We become a little bit more anxious, a little bit more difficult. So when you want to talk to somebody and you wonder why aren't they taking your advice, sometimes they don't hear it. Sometimes they can't. Sometimes it's so dangerous to do what you think might be the right thing to do. So you have to be very careful. And the best thing anybody can do when you know a battered woman is to listen to her, be her friend, be her support person. And for a lawyer, if you haven't worked with people who have been abused before, get some good consultation. That's the same thing to do for if you're a mental health professional, because not everybody's trained. And a lot of what happens to battered women is counterintuitive. We don't think, we don't expect some of the things that happen.
Right. Has there been an increase in domestic violence since COVID-19?
There has been, unfortunately, a dramatic increase across the world, especially here in South Florida. 3 times the amount of domestic violence has been reported. And because so many of us are shut in during the pandemic and quarantine, we have no idea whether it's more than that. So this is what we know. And of course, services are very limited if they occur at all. And so we are now advising women. We used to advise them to get out, to be able to leave the situation, but do it safely, because it's the most dangerous time is when you get out. And so now we're telling women, learn how to recognize the tension rising and try to calm down the situation, because you may not have a place to go.
Right. And that leads into my next question. What or where does someone go in the community to get help?
Well, the best place, especially here in South Florida, are the battered women shelters. The women in distress here in Broward County is the best place. But we also have a lot of treatment centers as well. Some of the mental health centers have treatment. Nova Southeastern University's College of Psychology has wonderful clinics there that are scaled to people's ability to pay. And there are a lot of independent psychologists who are trauma trained. You have to remember, make sure you ask if they're trauma trained to get into treatment. And psychotherapy is helpful in giving you back your strength, empowering you to be able to be who you are, but also protecting you, because it's dangerous. And we want to tell everybody to stay as safe as possible.
I think that's a great tip, to look for somebody who's been trauma trained.
Right.
We have focused the month of January on healthcare awareness, and today is to recognize the health and safety for victims and survivors of domestic violence. Is there anything else you'd like to share with us today?
I think one of the areas we have to be so careful about today is about our children. You know, the research that I do suggests that between 40 to 60% of the cases of domestic violence also have cases of abuse of children. Sometimes it's psychological maltreatment by the perpetrator, by the batterer. And the courts here in Florida, especially here in South Florida, are not good at recognizing the danger to these children. They try to get them to go back and forth and share parental responsibility. But when there's domestic violence, it's very scary for children. So my advice is for the lawyers, especially those who work with you in legal aid, is to really help these families to make sure the children are safe as well as the women are safe.
Thank you. We want to remind everyone how to reach Walker and Associates for services. The phone number and website for Walker and Associates will be posted in the comments below, so you can get more information. Thank you for joining us today, Dr. Walker. Thank you everyone for watching and tuning in on this Friday. Tune in for future Fridays with Friends. The link will be posted in the comments below for how to apply online for Coast to Coast Legal Aid services as well. Please remember to like and follow us on Facebook and YouTube at Coast to Coast Legal Aid for other important updates. We are live every Friday at noon to bring updates and information about local services for our Broward community. Thank you.